both of you were speaking in the session on learning from COVID-19. So, Soumya, can I ask you, what was your one big lesson from COVID-19?
I think the main lesson, which was also a surprise to me when I found that there was so little global collaboration, cooperation, not on the science side. I think there was a lot of scientific cooperation, but really on, once the solutions were developed, on agreeing how to share them and how to distribute them globally to have the greatest impact. That's the reason why we continue to see 50,000 deaths a week today, months after we've had vaccines and other tools to stop people from dying. So that is a sad lesson.
Yeah, the rise of vaccine nationalism and not vaccine equity. Yeah. Chorh, what was your big lesson from COVID?
Well, if I just pick one lesson, that would be integration. The incredible need for us to be better integrated. And integration has to occur across many dimensions: data, the response element, the way the response element integrates with the general health system, and goes beyond that to the engagement of society so that we're able to mitigate the negative effects of the pandemic. And as Soumya mentioned, also the integration beyond countries to have a more coordinated global response.
And indeed, this lack of coordination, particularly at the start of the pandemic, there was a poll, and that was people's number one concern. So in the world of GESDA, where we use the future to build the present, how do we address that issue, Soumya, of this lack of international coordination and collaboration? How can GESDA help?
I think GESDA can help by starting and advancing the dialogues. We need a societal dialogue which involves how we want to see the world. What do we want to see for the future? Do we want to continue to live in an inequitable world where millions of people are suffering and dying, not just from the pandemic, but from the impacts of climate change, from sea level rise, from non-communicable diseases, which are caused, we know, by social and environmental determinants. Is that the world we want? And I think bringing science, diplomacy, politics, and society together into this dialogue, where we can also talk about the ethics of building a humane society. How do we use the tools that we have today to really build a better world? And the WHO has put out a number of recommendations specifically looking at a healthier world. So how do we mitigate the impacts of climate change, which also will have impact on preventing future pandemics. But I think GESDA can really bring these issues to the fore and start a dialogue, because it does need people to come together from all these different disciplines to make meaningful change.
Chuan, you are on the board of GESDA. There are so many ideas coming out of this summit. How do you prioritize so that as a result of this summit, it's not just something and nothing?
Well, I think GESDA can contribute in two broad ways. The first, as Soumya mentioned, is to contribute to the broader collective understanding of the framework that needs to be put in place, the different component elements that will go into an outbreak response. So much better intelligence, and from the intelligence about what are the nasty bugs that could cause future epidemics, how do we understand what these bugs are, what are the targets for treatments, targets for vaccines, and then these will provide the enabling tools that policymakers can then use for the response. So we need a broad framework, and I think GESDA can contribute to that conversation. But then I think GESDA can also contribute to some of the solutioning. And I mentioned at the meeting earlier that I like to go camping. And when you try to set up a tent in a high wind, all the ends of the tent are flapping away. And eventually you have to tag them all down. But if you try to do it all at one time, you are unlikely to succeed. And therefore, we need to find which are the areas where we have the best chance to put a strong peg into the ground, to fasten some parts of the tent, so that it stabilizes the entire structure, and the other flapping bits can then be attended to. So I think for GESDA, we'll have to decide which are those strong pegs, which parts of the tent can be addressed first, and try to play a useful role in advancing the solutioning in those places.
And Soumya, from your perspective, the WHO, what peg do you think should be firmly knocked into the ground? What would success look like to you?
I think one of the key ones, and something that we can do, is making sure that these new technologies which we have today, I'm specifically talking about mRNA, but we've also seen successful technologies to manufacture, adenoviral vectored vaccines and so on, that these can be now shared, that the knowledge behind this can be shared so that we can have capacity to develop and manufacture and produce these vaccines for COVID. But then once that know-how is available to countries, they can then use it to develop vaccines and monoclonal antibodies for other diseases that are big public health problems. And I'm thinking about a disease like TB, where we haven't had a vaccine better than BCG, which was developed in 1921. So it's time for us to now use these learnings from COVID to also apply to other diseases, and that can only happen if we're willing to share the know-how and the technology more widely.
Soumya and Chorh Chuan Tan, thank you very much.